So what's up guys, it's your boy Wasim, and today I'm gonna talk about 5 essential applications that every healthcare professional working in Canada should have every day as professionals, whether we're pharmacists, nurse, physicians, students, etc. When we're working at the hospital, in clinics, in pharmacies, we come across various healthcare related problems. Whether we want to know if a certain type of bacteria is covered by the antibiotic we are giving to a patient, whether we want to validate the renal function of a patient to ensure that the medication they're receiving is safe, or if we want to give an anticoagulant to a patient and determine if it is appropriate or not, everybody has a phone in their pocket. And this is an extremely useful tool because it allows you to have different types of application that can be useful in your day-to-day clinical practice. I'm gonna go through 5 different applications that I consider to be foundational, essential for every professional working out there. So let's get started. A quick little disclaimer here before we start. I just want to clarify that this video is for information purposes only and does not constitute clinical advice. The caregiver is the sole responsible for his clinical decisions. I strongly advise that you always validate information in at least 2 different reliable sources before taking any decision regarding a patient's treatment. One of the fundamental questions that we can ask ourselves when we're analyzing a patient and a prescription is whether the kidney function of the patient is appropriate enough to allow for a given dose of a medication. We often rely on different type of equations such as the Cockcroft and Gault or the CKD-EPI equations to evaluate the renal function of a patient. It is therefore very useful to have an application on the hand, on the go, ready to be used. One of such applications is called MD-Calc, and this is what I use regularly. It has a plethora of different tests, for example, the CHADS test, the Hasbled test, and so on. So you can use that in your day-to-day practice in order to quickly determine different types of parameters for your patient. So another very interesting application that you guys can use is called Spectrum. It allows you to have different types of information regarding antimicrobials and also infectious diseases. Let's say, for example, you want to know the counterindications for daptomycin, you can find it in this application. It allows you also to have information about different types of pathogens, their susceptibility to different types of antibiotics, and so on. It is of note, however, that the specific recommendations of this application are adapted to Quebec's situation only. Therefore, it can be useful for a healthcare professional practicing outside of Quebec, but you should always keep in mind that these information are very local and therefore you should always validate this information with your local guidelines. Another application that can be extremely useful in your clinical units is called Thrombosis Canada. In this application, you can find not only the whole guidelines about different types of anticoagulation, let's say anticoagulation for a patient after orthopedic knee surgery or cancer or etc., but you can also find algorithms that will help you in your clinical decision making using what type of medication, using heparins or novel anticoagulant agents or warfarin or etc. So it's a very useful information to have in your pocket, in your phone actually, when you're in your clinical unit, you're in the emergency department, intensive care, etc. and you need to have fast, reliable information on how to anticoagulate a patient. Another application that is also exclusive to Quebec but can be very useful for other professionals outside of Quebec is called Antidote. Let's say, for example, your patient that you're finding at the intensive care is intoxicated with different types of benzodiazepines, then you will find the information on this application on what to use. For instance, flumazenil and its dosing and the various clinical considerations that you have to give for this specific type of intoxication. This application is extremely useful in your toxicology or intensive care unit when you want to decide what type of agent you're going to use. Another very cool app that people managing HIV patients can use is the Liverpool HIV chart. I find this application extremely useful, especially when I'm trying to find how to manage different types of drug interactions. In this application, you can compare the interactions between different treatments. For example, let's take a patient who is taking Biktarvy, a medication commonly prescribed for HIV, and this patient is receiving a new prescription of metformin, and you want to make sure that this medication is safe for this patient, or if there is an interaction, how to manage it. Of course, you have to keep in mind that this information is like a dictionary. You need to have a certain expertise in the management of the interaction to know what to do about that. It is, however, extremely useful if you want quick, reliable information about drug interactions for HIV patient, and I think that this application should be used by every healthcare professional managing HIV patients. Last but not least is the application for the GOLD guidelines for chronic obstructive lung disease, a illness that most of us will manage whether it is in hospital or in an ambulatory context, and therefore it makes this application very useful. Now, what you can find in such an application is different information about risk factor, the diagnosis, the pharmacological and non-pharmacological management, and the follow-up. For example, if you go in pharmacological management, you have different information that you can get for maintenance medications to initial pharmacological treatment to follow-up pharmacological treatments. What is very nice about this application is that it gives you various types of algorithms. For example, the algorithm that you will be using for the follow-up pharmacological treatment. And this is very useful because you can quickly have reliable information to manage such patients. So that's it, guys. I hope you enjoyed the video. These were my 5 top applications that I use on a regular basis. Of course, there are many other applications out there, for hypertension, major depressive disorder, polypharmacy and its management in certain categories of patients, and so on. I'm not being sponsored or paid by the applications that I just show you. I'm just being honest out there. This is what I use on my regular basis. If you guys like this video, don't forget to put a thumbs up and subscribe. We'll see you guys next time.